Alumni lecture, Sweet Dreams Are Made of This, Healthy Sleep Habits for Infants, Toddlers, and Parents with Dr. Robyn Stremler. My name is Laura Clark, and I'm the Director of Advancement at the Lawrence S. Bloomberg Faculty of Nursing. Before we begin, I wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississauga of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Before we get started, I'd like to welcome you again. I'm going to cover a couple of housekeeping items for today's event. Firstly, I wanted to let you know that during the duration of Dr. Stremler's presentation, your microphone will remain muted. You are welcome to ask any questions that you'd like in the chat box, and Dr. Stremler will try to address as many of them as possible as she goes along. At the end of the presentation, we have left time for a formal Q&A. During that time, you can use the raise hand function under reactions to raise your hand to indicate you'd like to ask a question and unmute yourself when you're able to speak. And then we can answer your question, or if you prefer, you can also continue to enter your questions in the chat box. Secondly, I want to let you know that we are recording this session so that we can share it with those who are not able to join us today. We will send you an email after the event with a link to this recording, as well as a survey, and we hope you'll complete it to give us some feedback on this event. Lastly, I also want to let you know that we plan to take some screenshot photos during this event to share on social media. If you're not comfortable with being in these photos, please just let us know or turn off your camera. Now it is my pleasure to introduce today's speaker. Dr. Robyn Stremler graduated with her PhD from the Lawrence S. Bloomberg Faculty of Nursing at the University of Toronto, where she is now an associate professor and holds the Bloomberg Limited Term Professorship in Child and Family Health. Dr. Stremler is also an adjunct scientist at the Hospital for Sick Children. Her clinical and research interests in sleep were prompted by her work as a nurse in various maternal infant care settings. Her program of research is aimed at improving sleep and related health outcomes for children and parents. She uses wearable sleep technology to assess sleep and deliver interventions through e-health and mobile health platforms. Research projects include sleep during pregnancy and postpartum, sleep for adolescents, and sleep for families with a child with chronic or life-threatening illnesses. Thank you so much for joining us today. Dr. Stremler, over to you.
Great. Thanks so much, Laura. It's great to be here with everyone. I'm going to show you a little bit about what Laura was talking about when she said I'm interested in wearable sleep technology. So you can see the little guy in the left corner of your screen. Patrick has an actigraph on his ankle, and that's a little device that measures motion, and then we're able to take those data and translate them into minute by minute understanding whether the wearer is asleep versus awake. So it's the same technology that you find in your Fitbit. Many of you out there are probably wearing something like that. And it allows us to get an objective measure of sleep. So my infant sleep studies have used actigraphy to measure infant sleep and parent sleep. And as Laura said, I'm also interested in adolescent sleep. And so while we can use those devices to measure sleep, we can also use them to try and intervene and improve sleep. And in the lower left corner, you see an example of a screenshot from an app that I've developed called Somni.
Robyn, I'm sorry to interrupt. I don't think the slides are moving for us.
Oh,
we're still on your title slide.
Sorry about that.
No, that's okay. I just want to make sure everyone can see what you're speaking about.
Yeah, I don't know why. Let me see, maybe there. That's done it for you?
That's done it. Yeah,
okay.
We can see it now. Thank
Sorry
you.
About that. So there you can see Patrick has the little actigraph on his right ankle. And we can also pair those kinds of trackers to apps on mobile phones to help to shape sleep. So that's some of the work that I've done with adolescents. But we're here today to talk about infant sleep, toddler sleep, and you can't talk about those without talking also about parent sleep. And so these are the kinds of things that are really important to think about when you're thinking about researching sleep or working clinically with people around sleep, is to understand that sleep affects all aspects of health. So the physical, the mental, and the social. And that is in part because sleep is affected by so many things. So it's shaped by our habits, by our DNA, by our physical environment. And you can even go as far and say that, sleep is a socio-cultural event as well. So your culture and the practices around sleep may influence your sleep in that way. You can think of sleep as a political act as well. If we think about who provides care at night, it's predominantly women. So there are all these socio-cultural political issues wrapped up in sleep. So thinking about drilling down into what are the effects of missing out, in particular, of missing out on sleep, on our health. When we look at mental health, we know that even one night of missing out on sleep, people will report that their mood is lower. When that sleep deprivation goes on over the long term and becomes chronic, then we know that people are at greater risk of anxiety and depression. And certainly, I think we've all had the experience of missing out on a bit of sleep and perhaps being a bit more irritable than usual the next day. And so we also all probably have experienced being having that irritability affect our relationships with others. So that's where that social piece comes in as well. We know getting enough sleep is really important for how your brain works. And so that means your cognitive functions can decline if you miss out on sleep. It's important to get sleep to form new memories, to undertake problem solving, learn new skills. And we know in terms of how we feel during the day, if we miss out on sleep, you're just kind of let down and fatigued. Then there are effects on your physical systems, so cardiovascular health. Sleep should be a time when you're resting. The body systems kind of get a break. And so if people miss out chronically on sleep, we see that their immune systems don't function as well. You see greater rates of inflammation, higher rates of hypertension. And it even affects things like your appetite hormones. So you make different food choices if you miss out on sleep chronically, heading for the higher fat, higher sugar foods. And we know that there's an effect on how your body metabolizes glucose. So we see higher rates of diabetes and obesity in those who are chronically sleep restricted. When we look at adolescents and young adults, amongst those who have higher rates of injury and substance use, we see that that parallels with missing out on sleep. So the bulk of this data comes from looking at sleep in older children and adolescents and adults. These things are a bit more difficult to measure in infants and toddlers, but in particular, the day-to-day mental health and cognitive function are really, really important for infants and toddlers and are perhaps more visible to parents in terms of how missing out on sleep affects their child's day-to-day function. And so that's often what we tell families to look for when they ask the question, how do I know if my child is getting enough sleep? The answer is how are they during the day? So are they a pretty happy-go-lucky kid? Are they, for toddlers, falling asleep at inappropriate times when they should be kind of engaged in their activities? Those are the kinds of things we look out for. So when I talk to families about sleep, these are kind of the things that I keep in mind. I kind of think of them as my sleep manifesto. They kind of underlie my thinking about sleep. So I wanted to share those with you. So the first is, I believe that parenting is not a competitive sport, and hence sleep should not be a competitive sport. But anyone who has spent any time with an infant or toddler has probably encountered questions about their sleep or comparisons about their sleep or their infant's sleep to others. And I think we need to appreciate there are individual differences. Everyone has a different sense of what it means to sleep through the night, because we all have different senses of what is enough sleep for us as parents. So always try and put people in the framework of trying to avoid comparisons. I also think, and I'm going to present research to you today that kind of backs up the advice that sleep clinicians give. So that research is super helpful for giving advice around what to do about sleep, and also for understanding how those interventions work to shape sleep. But ultimately, it's you who has to go home to your infant or toddler at night. And so I really think parents need to make choices around sleep that work for their family and that sit right with how they want to work with sleep. And so that will come up later on when we talk about sleep training and what that is and whether we all need to do that or not. Then I do come to sleep from a behavioral perspective. So I do think that you can shape your sleep, whether that's through the activities that you undertake or how you shape your physical environment for sleep. And that also means that I don't think that any one person is 100% a good sleeper every night or across time, or a bad sleeper. So I do think that we can take steps to help shape our sleep. And lastly, one of the things I love about sleep is every night you get the chance to do it all over again. So, if you have a bad night, you do get a chance to try and have a better night the next time. That's not to say it's easy to try and shape your sleep or your child's sleep. And so I think you do need to kind of, take it easy on yourself, be kind to yourself, and expect that there will be change across time. That's the one very reliable thing about infant and toddler sleep, is it does change across time. And so you think you've got things figured out, and then there's kind of a new developmental stage. So you just kind of have to keep coming back to first principles, which we'll talk about. Okay, so everyone wants to know, how much sleep do I need? And the National Sleep Foundation in the US put together this handy infographic. And you can see the dark blue bars in the middle of all the little cells. And those represent the recommended amount of sleep at the various age points. So we go from newborn to infant to toddler, so those first 3 bars. And I said sleep is individual, and you can see that there is quite a range of what is recommended amounts of sleep. Also, the green bars, either above or below the dark blue bar, represent what may be appropriate for some individuals. So there are a small percentage of people who are what we call short sleepers or long sleepers. And so that widens even further what our recommended or perhaps appropriate amounts are across infancy and toddlerhood. You'll see though for adults, there's a much narrower frame, so 7 to 9 for adults aged 18 to 64 years as being the recommended amount. So that's for the parents out there. So this slide just gives you a sense of how things change across time. I've got the first 6 months here. And when we look at the amount of sleep for the newborn period, I can't really define it much more than saying 14 to 17 hours. We can't be sure enough to say that there are a certain number of naps during the day. That's just 14 to 17 hours spread out in a quite irregular pattern over the first couple of months. Parents out there will know you just get multiple chunks of sleep spread throughout the daytime and nighttime. And so in that early period, you can focus on establishing a safe sleep environment. And we can talk about that later on if there's interest in that. And it's really a period of trying to get to know the signs that your infant gives for when they are sleepy, so that you can hopefully help to shape their sleep a little bit. And we'll talk about some tips for that. Getting on into 3 months, we do start to see a bit more consolidation. And by that, I mean you get clumping together of sleep into the nighttime and into naps during the daytime. So you can predict a little bit more when sleep is going to occur. And babies are able to stay awake longer in between naps. With that also comes a bit more alertness and interest, understanding that there is a greater world out there. And so sometimes, what people call the infant sleep regression, I think is really more a situation where babies are recognizing that they have influence over their environment and interact with their environment. So we'll talk about that a bit later as well. And then, it just keeps progressing, as you go month by month, you get a bit more consolidation of sleep in terms of naps clumping together. You're probably getting 2 or 3 naps at 6 months, and they're able to stay awake longer. I mentioned, a very common question being, how is your baby sleeping? And I think comparisons start to come in when we talk about, is your baby sleeping through the night? What we know is that up to half of 6-month-olds are still having frequent night wakings. So this notion of sleeping through the night in the very early months is probably not most people's experiences with their infant. And we can talk about some strategies to help shape that a little bit. So this is a study that we conducted a few years ago. We were interested in knowing, could we shape sleep early on in the life of an infant and a new mom's life? So we took moms who were in the postpartum units, so very early days postpartum, and we randomized half of them to proceed as they usually would, not to get any particular sleep advice, and half spent about an hour with a nurse talking about ways to improve their sleep and to try and shape their infant's sleep. What we found, we were hoping we would see differences in terms of how much moms slept, how much babies slept, and how often they awoke. We had had some promising pilot findings, but when we did the larger study, this was funded by CIHR, and we enrolled 246 first-time moms, we didn't see those differences. Those were our most important outcomes that we were after. When we asked women, is your sleep a big problem, a small problem, or no problem at all? We did see that very few women in the tips group who received these strategies said that their sleep was a big problem. But that was one of the more minor outcomes that we were looking at. However, the women really enjoyed learning about sleep, said they used the strategies. We measured sleep at 6 weeks and 12 weeks for infant age. And so we may have measured too early, or it may be that that is just not the best time to intervene and to try and make big differences in amount of sleep or number of awakenings. That has been borne out by a couple of other trials that have happened since ours. When we look sort of at the evidence as a whole, in the first few months of an infant's life, there may be strategies that can be reassuring to parents, helpful to parents, but that are not making big differences in sleep outcomes. So probably not worth spending a ton of clinical healthcare money aimed at that. If you're interested in seeing the tips booklet that women received, you can go to the bmj.com website and look up the article, and that booklet that women received is available as supplemental data, so you can print it out. And shout out to Julie Weston, who I see in the audience, one of our alumni and the senior trial coordinator. Okay. So here are a few of the tips that came from the trial. Again, these are things parents can try to help to shape sleep, all in the aim of trying to sort of better understand their sleep. In particular, understanding when your infant is sleepy. And you can look for signs like the baby kind of zoning out, rubbing their eyes, frowning a little bit. And you want to look for those earlier signs, because when an infant is crying, that's a really late sign that they're tired and need to go down for a nap. So we want to kind of beat them to that crying stage, because they're just much easier to settle and put down for sleep at that earlier point. So in the early months, you're not going to be able to make this happen all the time. But anytime you can recognize that your baby is sleepy, it's a good chance to try and put them down to sleep while they're still awake but drowsy, to kind of give them that experience of being in their crib and soothing themselves a bit and drifting off to sleep. The other thing to know about sleep in the early months is that babies sometimes wake up very, very briefly in the middle of a sleep cycle. They may even cry out a little bit or make a little bit of fussy noise. So we want to try not to rush in and pick them right up. They may be able to get themselves back to sleep, or you may be able to settle them back to sleep without going in, picking them up and turning it into a full-blown awakening. The other thing is, I mentioned circadian rhythm. That's kind of our day-to-day rhythm of feeling alert versus sleepy, and differentiates nighttime and daytime for us. We think it starts to develop at around 3 months. And you can try and shape that by light exposure and social interaction, because those are two big timekeepers, if you will. Our brains respond to light. And so if you're exposed to light at night, it disrupts the production of melatonin, which is a hormone that helps us feel sleepy and helps us maintain sleep during night. So this is really important for parents. You don't want to kind of be stumbling around and turning on all kinds of overhead lights in the middle of the night. And same for your baby. You don't want them to have a lot of light then. The flip side of that is that you can try and get outdoor light exposure during the day, just to really help. You're kind of programming the brain to understand when it's daytime and when it's nighttime. Same idea in terms of social interaction. You want to try and keep that bouncy, exciting play to the daytime as opposed to nighttime. So something that parents in the early days often don't think of is a bedtime routine. It's something we think about for older kids. You probably have a routine for yourself as an adult, but you can begin a bedtime routine even in the early months. And there's a fair bit of research. There are a number of studies that have been done from ages 0 on up. Even our adolescents benefit from having a bedtime routine. And it should just be brief, enjoyable events that you want to share with your baby, whether that's a cuddle and a song or reading a book. When those are done consistently over time, again, it just helps send the signal to the brain that it's nighttime and it's time for sleep. And then our next thing to think about is the relationship between feeding and sleeping. And often what brings families to seek out help with their infant sleep, or to perhaps be a little bit unhappy about how sleep is going, is if a sleep association between breastfeeding has been created. And what I mean by that is that every time the infant is going to go to sleep, they need to have certain conditions recreated. And so if a baby is always fed to sleep and then transferred to their crib, then that becomes something that they need recreated every time they wake up. And so a way to avoid that is to try and introduce something that kind of breaks up that connection between feeding and sleep. So it can be any kind of little activity, changing their onesie or changing their diaper, even just kind of propping them up in your lap for a little bit of a back rub and a burp. We'll talk more about that in terms of sleep training. So, I started off the talk telling you about how I use technology to measure sleep and to intervene with sleep. And now I'm going to talk a little bit about some concerns I have around technology and sleep. For a while now, I've been teaching prenatal classes aimed at infant sleep. Getting parents ready for the first few months. And one of the most common topics is what kinds of gadgets are the ones that I would recommend families purchase. So let's talk about those. Often families ask about white noise machines or apps that generate white noise. Sorry, I can see my slide hasn't turned here. And the concerns there for parents are sometimes that they live in a noisy environment. Maybe they have other children in the home. Maybe someone's recommended a white noise machine to them. The idea being if there's noise, the white noise is kind of this background shushing noise that can kind of cover over peaks and valleys of noise. And also there's some thinking that white noise mimics the noise that the infant might have heard in the womb, that being the blood flow across the placenta. So there have been a number of studies, dozens and dozens of studies looking at white noise as a sleep aid. You can see I've pasted in a systematic review that's been done recently. But that review found that in general, the evidence for using white noise is of low quality. So we don't have overwhelming evidence that it's effective. For me, though, there are two caveats for parents who are interested in using white noise. And one is related to the sound levels that white noise machines can create. So a few years ago, a group, the ear, nose, and throat group at Sick Kids, did a study looking at white noise machines and found that many of them could be turned up to levels that were actually damaging to hearing. And so parents have to be really careful that those are kept at a lower volume setting. The other thing is, infants take in the sounds from the environment, language from the environment, in developing their own language and their understanding of the social environment. And so we don't want to have white noise taking up so much of what infants hear that they don't have the opportunity to develop appropriately in that way. My last caveat is that you can develop a sleep association to a white noise machine. It's not the most difficult sleep association to overcome. The machines are, portable to some extent, especially if it's an app on your phone. But parents need to know that if their infant always has white noise on when they fall asleep at home, if one day when we are able to go visit grandmothers and friends, if you're traveling, you're going to need to travel with your white noise machine because the infant is going to expect to have that when they fall asleep if they've been used to that. I also get questions about these quite expensive items. So this new crib is new on the market. You can see the price tag there. And this is marketed as a responsive crib. So you place the infant in the crib. There's sound sensors that actually respond to the infant crying and start to oscillate, not swinging, but oscillate the surface of the crib back and forth in response to the infant crying. And so they purport that infants get more sleep. There isn't evidence yet of their effectiveness. I've been asked to consult on a grant that's gone in to see if an independent researcher is interested in testing this out to see if babies and mums actually do get more sleep using the SNOO. So there's perhaps more data to come in the next few years. And then there are some of these devices like the DockATalk or other sleep positioners. And although expensive, these devices are counter to Canadian Pediatric Society safe sleep recommendations, which is that these kinds of devices should not be in the crib, that it really should just be the infant on top of the mattress, free of any other soft materials. And then lastly, I get questions about monitors or monitoring systems. And there are a number of them out there on the market. Some of them have sensors under the fitted sheet on the crib that detect breathing motions. Others, like the one I have depicted here, the owlet, have a little sock that picks up heart rate and oxygen saturation for the infant. Again, these are these companies can't come out and say that they are aimed at decreasing deaths from SIDS or sudden infant death syndrome in infancy. But, the way they're marketed, that's kind of what's suggested to parents. There's no evidence of their effectiveness in that way, and that's because fortunately, SIDS is a very rare event. And in order to demonstrate that any of these technologies are able to decrease infant deaths, we would have to enroll thousands and thousands and thousands of babies in those studies. My concern with these devices is parents' understanding of that relationship. And also, we know from other studies of preterm infants and other infants that have been at higher risk of either low heart rate or difficulty breathing in infancy. We know that when we send infants home on monitors, there are a lot of false alarms. And that's true even among low risk infants, as in the study that I've pasted in here, looking at healthy infants versus kids at higher risk. And so this is a case where parents, I think, really need to think about how would they respond to false alarms. So you can see, the little owlet sock falls off the infant's foot. You're going to get a false alarm. What is that going to be like for you? How anxiety inducing and stressful will that be? Or alternately, will you be okay with that and feel reassured by having this kind of a device? So I think it's something parents need to think about before diving into to pay for these expensive things. So probably the most common advice that women get in late pregnancy or early postpartum is to sleep when the baby sleeps. And so what's the evidence behind that recommendation? We actually know that moms don't nap that much in the first few months. So about 2/3 in the first week or two take any naps at all. And over the first 4 months in this study by Montgomery Downs, it declines to about only 1 in 4 moms taking a nap at all at 4 months postpartum. When they do nap, it's not that often, only 1 or 2 times a week amongst the nappers, and it's not for that long. So a couple of hours early on, the first couple of weeks postpartum, but down to 10 minutes on average at 4 months. So although this is the most common advice that women get, women aren't really putting that into practice. And that may be because it is really tempting when the baby's asleep to try and get other things done. But unfortunately, we don't know if what we think might be true actually holds true, in that napping might help women cope better, either emotionally or feel better physically in the first few weeks. In order to kind of maximize sleep, what might work better for families is to either go to bed earlier if you're a bit more of an early to bed person, or to return to bed after your baby's first feeding in the morning if you feel like you can go back to sleep. So that might kind of help circumvent that feeling like you need to get stuff done during the day. Often parents report to us as well that they're not really nappers, or that they feel groggy after a nap, and that might be because they're napping too long. So we do know that brief naps can be refreshing. So if you're feeling really fatigued, A 20-minute nap will be refreshing, but you won't get into those deeper stages of sleep. So that will help you avoid that grogginess that you feel, or what we call sleep inertia, where you just can't get going after a long nap. I always want to give this shout out to partners. I think sometimes we fall into the default of thinking about dads as being a bit bumbling around the infant, and I want to dispel that by taking a look at Liat Tukotsky's study here, where she tracked dad's involvement in infant caregiving across the first 6 months of the infant's life. And she was able to show that the more dads were involved in looking after their infant at 3 months, then when we looked forward to when the baby was 6 months old, moms were getting more sleep and baby's sleep was better, longer stretches of sleep and less time awake at night. So there are these really real tangible pieces of the assistance that moms can get during the nighttime. We haven't had a lot of studies look at sleep for dads, partners. The ones that exist typically show that dads sleep less than moms and are sleepier during the day than new moms. I think it's also really important to note that, as we see with women, if dads miss out on sleep, if they're really sleep restricted in the postpartum, for them, it's also associated with higher rates of depression. And in the prenatal classes that I conduct, I always am sure to have a little bit of time to talk about the links between postpartum depression and parental sleep. There's a really large body of evidence linking short sleep, poor quality sleep during both pregnancy and postpartum to postpartum depression. And so I think it's important, for the families I work with prenatally to have that conversation, to think about, what would your plan be if one of you is really struggling with sleep and struggling with mood? Who would you reach out to? So I think these are useful conversations to have ahead of time, as opposed to not having had that conversation, and then it's a bit more of an additional barrier for folks to kind of reach out or to talk to each other about it in the postpartum period. Okay, let's talk a little bit about sleep in toddlerhood. So you continue to see that kind of consolidation of the naps. So naps, go from 2 to 1 at around 18 months is kind of the typical stage when a toddler starts to drop that second nap. We can see some of those developmental milestones that can interfere with sleep. So some kind of neat studies that have been done tracking developmental milestones over time. And we see a little blip in sleep when kids are learning to walk. It may just be that there's a lot of brain activity going on when that very challenging skill is being developed, and that just interferes with sleep for a little bit. We still see night wakings happen. So when we look across childhood, we know about 25 to 30% of families report some challenges with their child's sleep. So we see that continuing in toddlerhood. Issues that come up in toddlerhood are a bit more related to increasing independence. Toddlers are turning into their own little people. So they have more opinions about whether it's bedtime or not. They may be transitioned to a big bed, which gives them a little bit more freedom in terms of wandering around, either at the beginning of the night or the middle of the night. And so we'll talk about that in a little bit as well. So I often find sort of between 9 months and 12 months is when families start to think about sleep training or ask about sleep training. And usually what leads people to thinking about that or talking about that are the development of sleep associations. So we talked about that a little bit in terms of the link between breastfeeding and sleeping, but really sleep associations can develop with anything, any conditions that need to be present for the child to fall asleep. And so, you know, if you think if the infant is always breastfed to sleep and then put in their crib, when they do have a brief arousal in the middle of their sleep cycles, we all have these kind of brief awakenings during the night. They find themselves in very different circumstances than when they initially fell asleep. And so they'll cry out for the parent to kind of come back to them and recreate whatever it was, whether the white noise machine got turned off or they need to be fed or held, you know, whatever the conditions are. And so when people think about sleep training, really what they're thinking about is identifying what are the sleep associations and how can we remove those. And so feeding is one of the most common, and the parent involvement in the child falling asleep is the next most common. So, you know, what is sleep training? To me, they're really kind of two camps. And this is where what I spoke about earlier in the talk around parents needing to choose what feels right to them comes into play. So one approach is the cry it out approach. Those of you who are my age or older might have heard of that as the Ferber approach, or Ferberizing your baby, versus what we call camping out. Most of the sleep people that I hang around with don't feel these approaches should be started before 6 months. And that's because that's the age at which we have the bulk of evidence around their effectiveness and also their lack of harm. So what we're concerned about, in particular, the cry it out approach, involves leaving the infant unattended. And so we want to be sure that parent-infant attachment is strong before we start those approaches. So, you know, is sleep training right for everyone? No. And it's a question that parents have to ask themselves. You know, I talk to some families and they don't mind getting up once or twice a night with their infant. They feel like that's, you know, kind of one-on-one time for them with that child, and that's okay with them. Other people define sleeping through the night in different ways. So one person might be really happy with a stretch from midnight to 5, you know, a nice 5-hour chunk of sleep. Others really need a 10 p.m. to 6 a.m. stretch to feel themselves the next day. So you've kind of got to think about all these things. And so I don't, you know, really think everyone needs to sleep train. What is the evidence behind it? So I've got Michael Gradisar's pediatrics paper here from a couple of years ago, but it was kind of unique because there have been randomized controlled trials of these interventions, but he did a 3-arm intervention. So he compared the cry it out approach to the camping out approach to a control group and followed families over time. and also did a test for parent-infant attachment. So these kids were all 6 months to 18 months, so included some toddlers as well as infants. And what he found was both intervention groups, Cry It Out and the camping out approaches, saw a reduction in the time it took for the infant to fall asleep and reduced number of night wakings. And when
Robyn, I'm sorry, could you just advance your slides?
Oh again? Yeah, gosh, sorry.
No worries, thank you.
And when they looked at attachment across the 3 groups, there were no differences across the groups, and none of the infants in those groups had any significant problems with infant attachment. So that's reassuring to parents who do want to kind of take their own approach. So I think we've talked a bit about this, about the link between feeding and waking. One thing I want to say, I do have some extra slides around this, but I'm not going to go into detail. If feeding is the issue, our gut actually has its own circadian rhythm. So if children are used to being fed at regular intervals during the night, it's not just the sleep association, but they will be getting hunger cues at those times that they're used to being fed. So it's a little bit cruel to just go cold turkey and try and remove those feedings. So before doing any kind of sleep training, the advice is to gradually shift those feedings into the daytime, slowly reduce the feedings and shift the intake into the daytime. So what does the Cry It Out or the Ferber approach look like? The child is placed in the crib, reassured that the parent is there, but then the parent leaves for 5 minutes. The child will protest, hence the term Cry It Out. And then the parent returns. Again, it's kind of a brief, boring interaction, leaves again, this time for a 10-minute period, coming back and repeating that, never staying out longer than a 15-minute period. The challenge with this approach is that it really needs to be followed every time the child is put down. So there really needs to be a lot of consistency with this approach. And you also need to be okay with hearing your child cry. And this is often the sticking point for parents, or perhaps one parent if there's a partnership. So you really need to have everybody who's in the home on board with this approach so that you do get a consistent approach. What is your alternative? So camping out. So again, you need to figure out what sleep associations exist. If feeding is one of them, same thing, you need to decrease those feeds over time. This approach, you kind of need to think about what is the parent's involvement in falling asleep and how can you break it down into smaller and then further away from the child pieces. So you're still going to think about your bedtime routine. You want it to be a pleasant end to the night, but then you want to eliminate the things that lead to sleep for the child. So maybe they're being held and rocked in a rocking chair. Maybe they're twirling mom's hair. There can be any sort of combination of engagement with the parent. And so you just want to break it down, remove pieces at a time, and then have the child in the crib and move further away from the child. So this approach has less crying involved, but it takes much longer. The parent still needs to be aware of keeping interactions brief and boring. but as I said, this approach is also effective. So other common issues for toddlers are bedtime resistance, which I think sounds a bit subversive. So I think I like the term curtain calls a little bit better. Those are things like, I need to tell you something, if it's a child that's verbal, asking for water, struggling to get the child to go to bed. And so things that you can do, and these strategies would be with an older toddler who, parents will know their child best, whether they can sort of have these things explained to them. But you're, still going to have your bedtime routine that's kind of brief and pleasant. But if the child is getting out of bed and coming to mom and dad, they are just very consistently returned gently but firmly with as little interaction as possible to their bed. The challenge is when this happens in the middle of the night, for night wakings, it's hard for parents to be quite so, consistent with returning the child to bed if they're asking to get into the parent's bed, but that is the best approach. There's some evidence that having a bedtime pass can be helpful. And so that's a little pass that you create for the child. It's kind of a get out of bed free card. And so the child has it and knows that they can choose to turn it in for a glass of water or an extra hug or whatever it is that they want their curtain call to be. You can also, depending on the child, if you think they would be motivated by a sticker chart, so every night that they stay in their bed, they get a sticker and then they can turn it in at the end of the week. Younger children, a pillow prize might be more appropriate because it's a more immediate reward. So if they've stayed in their bed or done, whatever bedtime behavior you're trying to reinforce, then in the morning they would find a little toy or prize in their bedroom. If bedtime has gotten pushed really, really late, then you may have to do some advancing of bedtime. It's hard for a child who's consistently been falling asleep at 10:30 for them to all of a sudden fall asleep at 8:30. So if you are trying to shift anyone's bedtime, whether they're a toddler or an adult, you need to take a gradual approach because their circadian rhythm will have developed to be used to that later bedtime. The trick there, though, is that you still need to get the child up at the same time in the morning to keep trying to move their bedtime earlier. So there are early risers, and it may be that their room is getting a lot of light in. We do have individual sort of sensitivity to light in the morning. So you may need shades that really darken the room. This is one case where, if the birds or, the garbage trucks or whatever it is are waking your child up, you may want to use white noise. If it's a wet diaper that's getting them up, that's another reason to think about reducing any fluid intake during the night. Oh, and I see my little, my bedtime, move bedtime earlier has gotten has gotten truncated there. So sometimes kids get up early because they are going to bed too late. So I know that sounds counterintuitive, but there's a theory that if a child stays up too late, they've kind of missed their window for sleep, but they also get a surge of cortisol. And the thinking is that that just kind of revs up the system a bit more and primes them for waking earlier in the morning. So generally, kids should be going to sleep no later than 8:30. So it may be that bedtime needs to be moved closer to that time. You can also, have these little good morning lights that let the child know only when the sun is shining on your clock are you supposed to get up for the day and greet us all. When the moon is on the clock, you need to stay in bed. It's too early. Okay, so parents sleep. These are my top 3. They're pretty simple, but the first one I think is the hardest to do is to make sleep a priority. There are just, so many things that parents have going on that it can be tricky between work and kids and looking after other family members. But I will make the plea that if you get more sleep, you will be more effective in doing all those things that you need to get done. Consistency, just like with your kids, around your bedtimes and wake times, as much as that's possible when you have kids. And then we spoke about the effects of light at night. So that's one reason to avoid screens before bed. But the other reason is if you are doom scrolling on Twitter, that's a lot of content that's coming into your brain that isn't particularly helpful in terms of getting sleep. These last ones are what we call sleep hygiene principles. Just healthy sleep strategies that you've probably heard before. Thinking about caffeine intake. Sorry about that, almost sneezed. Thinking about alcohol intake, while it will help you fall asleep faster, we know that it interferes with sleep quality. There's a huge body of evidence around the effectiveness of exercise and its positive effects on sleep. We used to always advise people, don't exercise too close to your bedtime. We know now from studies that that is a very individual effect. So if exercising closer to bedtime doesn't bother you, then that's totally fine. Go for it. And when I say exercise, I'm not talking about training for a marathon. It's really just a walk around the block that is helpful for sleep. And then similar to what we've talked about in terms of environment, getting daytime light exposure and keeping the bedroom cool, dark, and quiet. Something I often hear from parents, new parents, is that they're surprised that even though they're tired when they're up with their infant in the middle of the night, they can sometimes struggle to fall back asleep. And especially in the early weeks when, you're really taking in a lot of new information, you're trying to figure out this new little person that you have. So your brain is very activated when you are up in the middle of the night. And then you kind of get the baby down, look at your watch and think to yourself, I only have a couple of hours before I have to be up again. So there's additional pressure put on you to try and fall asleep quickly. So there are a number of different relaxation techniques that you can try. I've listed a few here. The great news is that there are so many apps available now that really do walk you through these breathing techniques or relaxation techniques. They're also available on YouTube. We need to decrease vigilance in order to fall asleep. And that's what these techniques help you do. They kind of clear the mind and help move you into that decreased state of activation so that sleep can occur. Similarly, you don't want to have big important discussions about potentially stressful topics with your partner right before bed. Some people talk about, making to-do lists or thinking about what they have to do the next day. You might need to download your brain before sleep, keep paper at the bedside so you can take notes and then just forget about it to kind of help facilitate that. I've been very focused in this talk on sleep for healthy, typically developing kids, but I did want to acknowledge that our group has done a lot of work for looking at sleep in families who have a child with health challenges, whether that's a child with leukemia. My PhD student, Summer Haddad, is looking at sleep for parents who have an infant in the NICU. We've looked at sleep for parents of kids who are in the critical care units. So, the same sorts of principles apply to sleep for these families, but with the additional perhaps stresses, worries, physical challenges related to their illness. So I mentioned the US Sleep Foundation. There's also the Canadian Sleep Society, which has lots of patient handouts, some on kids as well. And then I wanted to let you know about babysleep.com. So I'm part of the International Pediatric Sleep Council. So it's a group of sleep clinicians and researchers. We've put together lots of videos answering questions related to sleep. You can look for a specific topic, or you can go in and put your baby's age or your toddler's age, and it'll kind of call up all kinds of topics that are relevant to your child's age. So it's a really great, driven by evidence and theory-based advice that you can check out. One last thing is that, I talked about my involvement in e-health and mobile health interventions, and this is one, Better Nights, Better Days. So this was led by Penny Corkum, who's at Dalhousie. She kind of brought together all the Canadian sleep researchers, and we developed an internet-delivered behavioral intervention to help parents who have a child with insomnia. So whether that's difficulty falling asleep or waking up frequently. And so I've got the publication there that's describing what the trial did. We're just working on the final paper, but there is evidence of effectiveness of this intervention. And we received money from Canadian Institutes of Health Research to study this intervention within the context of COVID. And so that study is recruiting people right now. If you know anyone who's interested, you can check that out at the betternightsbetterdays.ca website. So I am happy to take questions. I think we've got some time left.
Thank you so much, Robyn. Okay, so Michaela, you can go ahead with your question.
Thank you so much, Robyn. That was absolutely wonderful and helpful. I'm currently 5 months pregnant with twins.
Uh-huh.
I have an 11-year-old who I did sleep training with and it was excellent. And I was just wondering if there's any research or if you have any, I don't know, tips or tricks or deviations when there's two as opposed to one.
Right. Yeah, I don't know of any studies that have looked at sleep training techniques per se, like cry it out or camping out with twins. What I know is mostly talking to parents and, trying to get them on the same schedule is usually the route that most parents go. So trying to feed at the same time, trying to get consistent bedtimes and wake time for naps as well as nighttime sleep. I did have a couple in one of my prenatal classes a couple of weeks ago who had twins. It came up because another parent was concerned about trying to sleep train with another child. This couple was able to sleep train the one infant who was waking up a lot, and it didn't bother the other, that baby's twin who was sleeping just fine. So it can be done. I don't know of any studies, but trying to get them from the get-go as on the same schedule as much as possible is probably your best bet.
That's great. Thank you so much.
Okay.
Thank you. So next we're going to go to Nicola, and then there's a question in the chat we'll address after that.
Okay.
Hi, thank you. That was an excellent talk. So I actually have an older child than the talk was about. I have a 7-year-old with some chronic health issues. I'm just curious because I thought about asking a pediatrician to do a sleep study. Do you know if that's something that would be done for a child that age, or would it be something like you've mentioned in regards to devices you would use at home?
You can certainly have a sleep study done for a child that age. You can do a sleep study at any age. Typically, you need a referral for that from your pediatrician to a sleep center. Ideally one that is used to working with kids, because there is a lot of equipment involved, and the ones that see kids regularly are just so great about putting on all the electrodes and really explaining the whole procedure to them well. So look out for that they have experience with kids, but you can certainly ask for that.
Okay, thank you very much. Appreciate it.
Okay.
Thank you. So we have a question in the chat from John. He's wondering about your advice about baby in your room in a bassinet versus baby in the crib, and if you have advice about timelines for that.
Yeah. Yes. So I've got my slides on reserve here. So these are pulled from the Canadian Pediatric Society recommendations around safe sleep. So their recommendation is that for the first 6 months, your baby should be in your room. And these recommendations all come from taking a look at the evidence around SIDS deaths, so deaths from sudden infant death syndrome. It's really challenging to do that kind of research because those events are so rare. But what they do is they look at the circumstances around the sleep environment, etc., in the cases where babies died of SIDS. And then they take a look at sleep environments for kids who were unaffected. And what they found is, for some reason, having the infant in your room confers a protective effect. So it lowers the risk of SIDS. So that's why the Canadian Pediatric Society makes that recommendation. You know, all these safe sleep recommendations are, you know, another area where parents kind of have to take in the information around how do they perceive their own risk, what do they want to do to try and decrease risk, and what works best for their family. So I can tell you what the Canadian Pediatric Society recommendations are for that situation.
Thank you, Robyn. We have a couple of different questions in the chat related to co-sleeping. And I think the easiest way is maybe you can just talk a little bit about co-sleeping and then transitioning from co-sleeping to separate sleeping, I guess.
Sure. Yeah, so I'm just reading Joe's question there. So got a 5-month-old that takes short naps in the crib, but can sleep longer in bed. And so in some ways we can probably think about that as a little bit of a sleep association that's developed. Sleep happens better in the presence of the parent. So how do you increase the duration of the naps in the crib? It's probably by trying to work on that sleep association that he's developed to sleeping beside you. Night sleep is good, you say, so that's great. Excellent news for that. But yeah, I think just you know, trying to be consistent is probably the best strategy for that daytime sleep, to try and shift that association away. Looking at the next one. Okay, looking to move a toddler who's, I assume when you say co-sleeping, you mean sleeping in parent's bed to sleeping in his own bed for the whole night. Yeah, so I mean, you'll know your toddler best. That's going to be a big change. You might need to break it down, and it's you know, if we were working together in a different way, I would have a very long conversation with you about all of the things that are going on. You'll know your toddler best, whether it's something you can just make the switch to and maybe incentivize them with some of those sticker charts. If that's going to be if that's the kind of toddler you have who's motivated that way and can make those sort of easy behavioral changes. I did not have those toddlers, so you may need to break it down a bit more. So you know, it's kind of up to you how you want to move them into their own bedroom. You may have to be in there with them for a little bit to get them used to that big change. Yeah. I'm not seeing, someone's asked, how do you get to work with me? I'm not seeing clients. I often think about hanging out my shingle because lots of other people have hung out their shingle, but I'm not seeing patients that way. You can come to prenatal classes at Mount Sinai Hospital, but so someone has raised the issue of, you know, is having an infant in the parent's bed dangerous? And certainly the Canadian Pediatric Society recommends that the infant sleep alone in their crib or bassinet. But again, this is one of those issues where, you know, parents need to think about how they have taken steps to reduce their risk of SIDS. They need to be informed about the Canadian Pediatric Society recommendations, which you can see at caringforkids.cps.ca. And then parents, kind of need to make their own choices, as we do as parents for, seems like many decisions across our kids' lives. So Eli or Ellie, I'm not sure, is asking about putting the baby down drowsy but awake. Yeah, this is a process. What happens if the baby wakes up fully and gets upset with this method? You do, have to, if a baby is full on crying, then you've kind of got to use your settling strategies to bring them down from full on crying to hopefully get them into a settled place. And over the first few months, that's really going to be practice, right? It's not going to work every time. You're going to have more patience for that at certain times than others. So you don't have to, I think we don't want to put a lot of pressure on parents, especially in the early months, that they have to get this perfect every time right from the get-go. It's a process. You're just trying to give the infant that opportunity to know what it's like to be in their own crib. When they wake up, it's a familiar environment. But of course, the first few months, your baby needs you, right? You can't spoil them in those early months. So you do want to go to them and comfort them. Yeah, someone's brought up the Montessori floor bed, which I actually only heard about myself a couple of months ago. I hadn't heard about this. So yeah, there's this recommendation that the baby sleep on a mattress on the floor. I don't know of any research studies looking at that. I have a few concerns around safety for that, particularly infants learn to roll over and we don't really get any warning about that. So I just sort of have this vision of this little person kind of rolling their way out the door. So I think if you're thinking about a floor bed, you really want to take some steps to ensure it's a really safe environment for the infant. But I don't know of any research. How do you help parents recognize that sleep is a priority? That's a great question. Yeah, I think research could be helpful if that's kind of what motivates parents. Sometimes I think keeping a sleep diary can be really helpful. And in some ways, early postpartum is a good time to try that out, because parents are tracking a lot of stuff anyways in the early postpartum. So, you're keeping track of dirty and wet diapers, when you fed, how long you fed, on what side, that kind of stuff. Parents could track their baby's sleep and their sleep, and also a little bit of a gauge of mood. So I think, kind of what gets measured gets managed is the business term for that. Being able to see how much sleep you're getting or not getting can, and knowing what your target is and where you feel your best, can help you see that maybe you're not making it a priority, or you're missing it a little bit. I think too, if you're dealing with partners, then I think it's helpful if there's some back and forth around how will you each support each other to get sleep. So can one of you, when the infant's a bit older, stay up and give a bottle so that the other partner can go to sleep early, and then maybe, the breastfeeding happens at the next feed. So it takes some conversation about, how can I support you to get a nap? How can we kind of both maximize the sleep that we're getting? There are not studies that I know of. There's a question about a child with a history of trauma. I'm not involved in the study, but there is a study going on taking the Better Nights, Better Days intervention and applying it to kids with neurodevelopmental disorders, ADHD, autism. I think that group has plans to tailor the intervention in the future for kids who have a history of trauma. I think that is in the works, but I don't know of others. Again, I think it's working on probably that sense of decreased vigilance in order to help with sleep might be a target there. How are timelines, guidelines adjusted if kids have developmental delays? I think you're asking if maybe the child was born preterm. Yeah, you're going to see a lag in that circadian rhythm developing. So you kind of have to go with their corrected age when you're thinking about how much sleep and when to expect naps to consolidate those kinds of things. Can infants have nightmares? They might. We know that infants under 6 months have what we call active sleep and quiet sleep. Active sleep is akin to our REM, or rapid eye movement sleep, that we have as adults, which is when our dreaming occurs. It's also when a lot of memory consolidation, learning new skills, taking in and consolidating new information, that happens during REM sleep for older kids and adults. So we assume that that's happening with infants. But, to have a nightmare, you need to be able to report a nightmare. So we kind of have to wait for toddlers to be able to know, for them to be able to report a nightmare.
Thank you so much, Robyn. This has been a really great talk. And I'm sure, as you say, I'm sure we could talk for hours and hours about everyone's questions, but I think you've given the parents and the grandparents and the healthcare providers on this call a lot of really good information, a lot of great studies referenced. I really just appreciate your time sharing all your knowledge with us today. Thank you so much.
Thanks, Laura. It was great to be here.
Great, thank you. And I just want to thank everyone for joining us. I hope you've enjoyed this event. I hope you'll stay tuned for the email that we will send out afterwards with the recording of the presentation, as well as a survey that we hope you'll complete. There'll also be some information about more Bloomberg Nursing upcoming events that we hope you'll attend if you're able. So thank you so much. I hope everyone has a great evening and a good sleep. Thank you so much, everybody.